Hello everyone, my name is Blake Hardy. I'm one of the physical therapists here at Core Physical Therapy. We're going to talk to you today about some of the specialized techniques that we use here. The first one we're going to discuss is called myofascial release. Fascia is tissue in our bodies that goes all over the place. So if you think about a rubber band, it's able to elongate and then it snaps back. And that's really very simplistically what our fascia does is as we move, it elongates, it stores energy, and then it has force to help our muscles contract and help us move. So let's take a real example of these fascial tracts in the body and how complex they are, how extensive they are, and what it means if they don't move in the way they're supposed to. So if you look at the bands on our friend here, there's 3 different colors representing 3 different fascial tracts. And as you can see, they all start way up in the body and they proceed all the way down to the toes. So if we think about that old adage about the neck bones connected to the leg bone, you can see why, because these are continuous pieces of tissue that go from top to bottom. And so you can see we have a tract that goes from the head straight down the back to the back of the leg. We have a tract that goes down the outside of the body, and we have a tract that sort of wraps around the rib cage, wraps around the pelvis, goes all the way down the legs. So how do we figure out where to start? Because we know, as we've talked about, this fascia goes all over the place and it can affect every part of the body. So we try to have a few places where we get some initial assessment and start to understand how someone's body is moving and where most of their restrictions are at. So a really easy place to start is in the legs, and we can do just a little rotation of the leg to see how one stretches and then the other, and then we can take them up, and then we can take them up, and then we can give just a little pull to one side. And what we're looking for is one leg, or depending on where we're at in the body, do we see one side consistently tighter than the other? We're going to start to get suspicious about that tight side, and that's where we're going to want to start our treatment so that we can help that fascia move in the way that it's supposed to. So as I was working with him here, his right leg felt a little bit tighter. I'm going to come up to his pelvis to see if that might be the end of where his tension is. Still kind of tight up here also. So then we might come all the way up to the rib cage and start to see, okay, things are getting looser up here. So I'm thinking more pelvis down in terms of where his restrictions are at, as well as on the right side. So then we could further differentiate, is it on the front side or is it on the back side? It feels like it's probably more on the front side. So then it's just a matter of coming into where we feel like the restriction starts. So I'm going to put one hand on the front of his pelvis, and then I'm going to put one hand just a little bit lower. And if we think about this fascia as it lays in the body, it's a 3-dimensional structure. So I've got to attack it in a 3-dimensional way. So I'm going to put a little bit of traction with my hands coming apart. I'm going to put a little bit of traction with my hands going side to side, and then we're going to twist. So I've got one hand here, and I'm going to pull my top hand towards his head, bottom hand towards his knee. Then I'm going to go right and left and figure out which direction is tighter, and then we'll add our twist. That gives us our 3-dimensional pattern. And we're staying in a place where I call it the elastic zone. We're not going as far as the tissue can go, we're just going to where it just starts to stretch. That way we're not upsetting the nervous system, and then we're just going to be patient, and the body's going to let go of a little bit of that tension, and we're going to follow that release for just a minute or two, and we'll let it proceed, and then we'll reassess. Well, hopefully this provides you with some useful information about some of the specialized techniques that we use here at Core Physical Therapy. What we just covered is called myofascial release. It's a great technique for so many things that are causing people pain. If you have questions, please call us. We'd love to tell you more, and we'd love to have you come in so that we can help fix what's wrong and get you back into your life.